City Commission meeting in Huron, South Dakota on Monday, November 9th, 2020. Roll call, please.
Smith.
Here.
Luke.
Here.
Wright.
Here.
Robish.
Present.
Mayor Harrington.
Here. Join me in the Pledge of Allegiance, please. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Agenda approval. Tonight we do have an amendment to our agenda, and it will be, we're going to have an 8.7, and it's going to be a fuel tank surplus recommendation. So,
You're gonna do public forum first?
yeah, why do I do that?
Number 2.
Yeah, oh, what's that, follow one? Sorry about that, Doug. Public forum comments may be sent during a live meeting broadcast in the city's YouTube channel. The link is listed on city website at www.huron.com/city government. In order to use the YouTube chat feature, please create an account with the YouTube and Gmail or using your existing accounts. Please state your name and address for the record. Public forum is limited to a maximum of 3 minutes per person. And today we have Nathan on our computer, so if you have any questions you want to call in, he will notify us throughout the meeting if we have one, and we'll stop what we're doing and take your question and hopefully have an answer for you. Other than that, is there anybody here that wants to speak to public forum tonight? Yes, Commissioner Clute, you may have this.
Thank you, Mayor. The Solid Waste Department rubble site will be closed to the public this Wednesday, November 11th, in observance of Veterans Day. If you have any questions concerning this, you can call 353-8542.
Thank you, Commissioner Clute. Now we can go to agenda approval. We're going to amend the agenda to add an 8.7 fuel tank surplus recommendation. So I would invite a motion to approve.
Move to approve the agenda with the amendment.
With the amendment, okay, Commissioner Robish, have a second on that?
Second.
Second on Commissioner Smith. Roll call vote, please.
Smith.
Aye.
Clute.
Aye.
Wright.
Aye.
Robish.
Aye.
Mayor Harrington.
Aye. Number 4, consent agenda. Matters appearing on the consent agenda are expected to be non-controversial and will be acted upon by the commission at one time without discussion, unless a member of the commission requests an opportunity to address by any given item. Items removed from the consent agenda will be discussed at the beginning of the formal items. 4.1, minutes of November 2nd, 2020, City Commission. 4.2, fuel quotes for city departments. 4.3, set November 23rd as a public hearing date to consider transferring the following alcoholic beverage licenses from Todd Manolis to Gus Manolis, Manolis Grocery, 47 3rd Street Southwest, to Todd Manolis and John Manolis. Marcus, I'm sorry. Manolis Grocery, 47 3rd Street. Retail on and off sale malt lit beverage, South Dakota farm wine license. Retail on and off wine and cider license, and a package of off sale liquor license. 4.4, set November 23rd as a public hearing date to consider 2021 liquor and wine license renewals. 4.5, set November 23rd as a public hearing date to consider a lease agreement with the Greater Huron Development Corporation for a spec building located at 191 Union Avenue Southwest. 4.6, personnel items. 1, regular status of Code Enforcement Officer Mike Harrison under completion of probation period. 4.2, regular status of Human Resource Manager Nathan Hofer upon completion of probationary period. And number 3, hiring of Jerry Dennis as a year-round part-time custodian at the street department. 4.7 is payment of the bills. Consider a motion to approve the consent agenda.
Motion to approve consent?
Commissioner Smith, motion approved. Second, Commissioner Robish. Roll call vote, please.
Smith.
Aye.
Clute.
Aye.
Bragg.
Aye.
Robish.
Aye.
Mayor Harrington.
Aye. Petitions and Communications 6.1. Pauline, do you have a comment on this one?
Sure, Mayor. This is a new license, a new malt beverage subcode farm wine license for Carlson's. Both the fire chief and building official have done their inspections, and we all recommend approval. There's no comments.
Okay. Have a motion to approve?
Move to approve?
Need a second?
Second.
Smeckett? Any discussion on this one? Seeing none, roll call vote, please.
Smith.
Aye.
Clute.
Aye.
Bragg.
Aye.
Robish.
Aye.
Mayor Harrington.
Aye. Department items, 8.1. City offices will be closed on Wednesday, November 11th in observation of Veterans Day holiday. 8.2. Consider recommendations of Park and Recreation Board for a designation of Bushman Park. Doug, do you have a comment on that?
Well, the Parks and Rec Board recently met and voted to recommend to the commission that the West Tower Park be renamed as Bob Bushman Park in recognition of his many contributions to the Little League program. And apparently he lived right next to this park, and he would go over and water the trees too with his own garden hose, according to Laurent Clark. But anyway, he's a big supporter of the community, and they wanted to honor him by doing that. And so I would move to approve that recommendation from the Park and Rec Board.
Thank you, Commissioner Clute. We have a motion to approve. Do we have a second on this item?
Second.
Second by Commissioner Robish. Any further discussion?
If I may.
Commissioner Smith.
The park that is being talked about, Doug, that is on about 7th and Wyoming, does that sound right?
I think that is the approximate address, yeah.
And I, just as a disclaimer, I'm not opposed to naming that park after Mr. Bushman. Obviously, he was very instrumental in the Parks and Rec side, but has there been any conversation about future abandonment of that area as a park?
I don't think so.
Or
As a matter of fact, they're going to tear down the water tower next year that's there, and then that's going to enhance the park. They're hoping to add some future stuff.
Yeah, I think they do have some plans to,
Yeah.
but we gotta get that structure down.
Yeah.
And I think that's the one where the telecommunications equipment was on there, and that lease is gonna be up, and so at that point, we can tear that down.
Yeah.
were they going to put a building on that to help house some of that telecommunication?
Boy, I don't remember those discussions.
That was discussion at one time, and then they moved it down to the radio station, I think.
Okay. I guess that's the only thing that comes to my mind.
Yeah.
So I'm not trying to put you on the spot.
No. Oh, you did though.
Well,
I was there to help you, though.
well, what I can, I won't even say it. I can hold you speechless. That's
That's all right, that's okay.
Any
Bob
other,
Bushman Park.
It's fine. I just had to ask a question.
any other discussion on that? Okay, roll call vote, please.
Smith.
Aye.
Clute.
Aye.
Bragg.
Aye.
Robish.
Aye.
Mayor Harrington.
Aye. 8.3, consider lease maintenance and authorization agreement with NB Golf LLC for golf carts and authorized for the mayor to sign. Commissioner Smith.
Thank you, Mayor. This, as you guys, as you know, was brought before us a couple weeks ago. There was some consideration from Commissioner Bragg to see if there's cooperative effort that can be done with the country club on this. Ben Drott had looked into that with NB Golf, and NB Golf apparently would not, or is not in a position to split the contract. It would then fall back under the lease agreement with the city of Huron, making us responsible for the lease in its entirety, along with, quite simply, there's not enough carts being asked to split it up. So that was the end result on that. I think that was the main question of approval of the lease.
Need a motion to approve?
I would move approval.
Thank you, Commissioner Bragg. Second, the motion?
Rich.
Rich,
Moved.
okay. Need a second?
I'd second it.
Second, Commissioner Smith, okay. Any other discussion on this topic?
Just that I appreciate the time that was put into that, and that's something hopefully moving forward with the golf course, we're gonna make every attempt where it's possible. This one was not feasible, but I appreciate the extra time taken to consider that, so thank you.
Roll call vote, please.
Smith.
Aye.
Clute.
Aye.
Bragg.
Aye.
Ravish.
Aye.
Mayor Harrington.
Aye. 8.4, consider lease agreement with Ben Drive for use of Broadland Creek Clubhouse. Brian? Commissioner Smith.
Thank you, Mayor. Again, this is a item that was presented 2 weeks ago and goes with the timing of the MB Golf lease consideration. At the time, we did not have a formal lease agreement drawn up, and it was the request to have that presented before the commission prior to approving it, and that's where we're at today. The final lease agreement to Ben would be until March 30th, 2021, basically getting through the winter months. He will be responsible for upkeep, maintenance of the facility, along with utilities and a nominal rent fee of $100 to help promote, continue to promote golf out there. I would request approval of the lease agreement.
Do we have a motion for the?
I would move that.
Commissioner Smith?
I
Move
would
approval.
second it.
Second by Commissioner Bragg. Any other further discussion on this topic? Seeing none, roll call vote, please.
Smith.
Aye.
Clute.
Aye.
Bragg.
Aye.
Ravish.
Aye.
Mayor Harrington.
Aye. 8.5, consider COVID-19 mask protocol policy for city employees and buildings. This is a topic that we discussed last Monday night, seems like a weekend. It's a policy we're going to use for all of our city buildings. And I'll read the main gesture of it. It's basically because we like to keep our city offices open, and we're trying to stay with the COVID guidelines. Visitors to city buildings will be required to wear facial covering, as will city employees providing face-to-face customer service. Public is encouraged to utilize various options to eliminate or reduce visits to city facilities, including online payments, calling, and emailing questions for information. Topics in this: city commission meetings. Citizens attending commission meetings and committee meetings will be required to wear masks when social distance cannot be attained. Due to COVID-19, social distancing protocols previously established for the commission room seating remains extremely limited. City staff masks. City providing face-to-face services to public will be required to wear a mask. All city staff shall wear a mask when in city vehicle with another employee. Visitors mask. All visitors to the city building will be required to wear a facial covering. Mask will be provided if necessary. In-person services will be refused to anyone who refuses to wear a mask. Phone, email, and online options. As recommended last spring, citizens are encouraged to use online and phone options to conduct businesses with City Hall and city departments to minimize personal visits to city facilities. The city advises residents to consider automatic payment with their utility bills and pay parking taxes online to ways to minimize city's visits to the City Hall. In addition, residents and questions regarding building permits and other city policies should be considered calling or email the individual city department. Signs are going to be posted on lobbies of City Hall and all other city buildings advising public that masks are to be required for interest or after continued upsurges because of continued upsurges in positive COVID cases. A little update on this, the signs that we're going to put on all of our city buildings are, I was brought to my attention that there's some cities in our state that all their businesses have signs on their windows. And what's in the signs on their windows is not so much that the mask is required, it's asking them to join that facility and that business in enhancing the use of mask at all the facilities. It's an encouragement to them. So what we're going to do, we're going to put signs on all of our windows and all our buildings, and we're going to say something to that effect that we are encourage you to wear a mask in this facility. If a mask can't be, if you do not have a mask will be provided. That will be the sign, and it's going to have a picture of a mask on it, and Sean has been doing some engineering how it's going to look, so we're kind of excited what we're going to put up there. We're hoping that this won't, the requirement will still be there, but the encouragement to utilize and if it ever comes to a point where we have to explain, we can explain why we have a sign the way it is. But we just want the public to join us in the effort to quell COVID-19 as much as we can. So with that, and I might add, this is a living document. We can change it. We can eliminate or add as time calls for it and as the COVID calls for too. So we're excited to get the protocol out there. And it's certainly needed at this time. So any questions? Should we have a motion on this? Do we have a motion to approve?
I'll move approval.
Move approved by Commissioner Coops. Need a second on this?
Second.
Second by Commissioner Smith. Now time for discussion. Any discussion? Commissioner Coops, please.
Okay, well, your comment about the signs encouraging, this policy though does require
Yes, it does.
people to, where it's not an encouragement, this is
Yes, it does.
actually requiring, which is what I think we need to have. And I want to make sure we know that on the city commission meetings, everybody needs to wear a mask, and that would include our employees too.
Yes.
Not just citizens attending the commission.
Yeah.
I mean, anybody that's in the commission meetings needs to have a mask on,
Yes.
right?
Yes. That's there. They all understand that.
Okay, all right, I just want to be
As
clear.
they're sitting
And
there.
then I have one more comment. And we had a work session on this last week, and it was brought up about the police. And I believe the chief said, well, we can't wear them because we need our sense of smell. And I totally understand that, and I agree with that, but not in every instance of the police having contact with the public would that be necessary. And so when the situation, and you can comment on this, Chief, but just let me finish my thought here, but when the situation presents itself that you would like to use your sense of smell to see if a driver or anybody is under the influence of whatever, then you could take the mask off at that point. But there are innumerable encounters between the police and the public where the sense of smell is not, indicated. I mean, you're just dealing with the public, and it's obviously not a situation. I really want the police to be out there wearing the mask when they're encountering the public as much as possible, in my opinion. So I thought that had to be clarified since we did have some discussion about that last week. So, and I think this would say that. It doesn't distinguish police from anybody else. It says city staff providing face-to-face services to the public will be required to wear masks. So I think that would be encompassed in that. But since we had that discussion with the chief last week, I want to have some clarification of that going forward.
And as I read the document, it says in city buildings or city vehicles, but our investigators have already started wearing masks when they have face-to-face contact in the building up here. The officers are also wearing a mask when they meet somebody in the city buildings like this. So they're starting to wear the mask and try to do their part of it. But there's other times where not just the smell, if they're in their car and they have to jump out to apprehend somebody quickly, they're not going to stop to put a mask on. That would endanger themselves and the public also. I would agree that there's times that they could wear them out there, but to try to get them to wear it all the time, and the people that are going to see it and call us aren't going to know what's going on in the street. There's times that to mandate them if they're, last Friday we had to apprehend a young man, we had to chase him for a block and a half. They're not going to grab the mask to go apprehend a person that's wanted by DOC.
Well, we can carve out exigent circumstances where it wouldn't be necessary, and investigative situations where it would impede the investigation. But certainly if you stop somebody from speeding or a stop light violation, I don't think you need it until you have indications that perhaps they're under the influence, and then you can take your mask off and see if you can smell the odor of alcohol or whatever. But
a lot of
I'm of the opinion that we need to be very out there with that. That's my point, as much as possible.
Commissioner Smith?
The other thing maybe to keep in perspective is that this is a city policy within the city handbook, the employee handbook. It's not an ordinance that would, so in this situation where an officer didn't wear their mask for whatever reason, it would be more of a city issue, an employee issue, to which they could plead their case, so to speak, to HR if they're called in on that, of saying, hey, you're not wearing your mask, kind of a thing. Well, it's a policy violation and not an ordinance violation.
Correct. That's a good point.
It'd be a kind of an HR matter at that point. A couple of questions that were raised on the street, so to speak, had to do with our other, when we think of city facilities, I think generally in our mind we go directly to City Hall. And the other prominent buildings that the public is involved in, the library, Huron Community Campus, etc. But a couple of buildings and facilities that escape this in our minds are what we approved tonight with the lease of the clubhouse. But probably more on a larger scale has to do with the event center or hockey arena, thank you, Bergman Arena. And how are we going to mandate that, or what is the protocol on that through this? Not trying to confuse it, but I was asked.
No, I think those are good points.
And I'm not picking on hockey or that facility, but there are known large events coming up at Bergman Arena for hockey. And it was questioned what's the protocol on that then? If the spectator comes in and says, that's a bunch of bunk, I'm not gonna wear a mask, how do they handle that? The people that are working that event? Does that deserve an officer call, or?
And to follow up on that too, with the, a mask will be provided, so that would also mean that I assume at City Hall, we have the disposable masks we'll be providing, but that would be similar, so if someone hosts a wedding at the event center, are we gonna give a mask to any wedding attendee that doesn't have a mask, or are we gonna have a box of masks for everybody that comes to the hockey arena that isn't wearing one? Is that, obviously, like Brian said, this was something separate from what we were all thinking of when this was drafted, but
I would think
that's part of the
that
consideration.
as far as weddings go, that would be the person who's having a wedding will put that in their invitation. This is COVID-19, we're going to require masks at this facility, just like they do at funerals, places like that. So any of that organization. Getting back to the hockey deal, now, they lease that program, that building from us, or not?
No, it's a city building.
Okay.
They pay some utilities in it.
But we have a lease, don't we?
We have a lease that they pay some utilities, yes.
So similar then to like what we just approved tonight, would there be a different stipulation if it's a situation where it's a separate party leasing, even though it's still a city building, could there be a different consideration for how things are observed?
Correct.
We could write in exceptions to those facilities, to this policy, if you want to.
Have you talked to, has the Park and Rec Board talked about the hockey facility as far as masks and stuff like that? I know, I saw something out of one of their Park Board meetings that they're gonna have their people in their foods places and stuff all masked up and everything like that, but didn't really talk about the fans that are gonna be there.
I think, and I wish I had that with me, but I think that was produced by the hockey group themselves.
Yeah. Yeah.
So the Hockey Association has considered this issue, and I think they will be taking some measures, but I don't have that right in front of me, so I don't know how far that goes.
Yeah,
I would think that's based on the strict reading of this policy, if we adopt it, that you could make the argument that any hockey thing would have to have a mask.
Well,
And any wedding would have to have a mask at the event center, and anybody going out to the pro shop at Broadland, when Ben's gonna be doing this golf simulation thing, would also have to have a mask. I mean, so if you wanna carve those out or make exceptions to that, because I don't know if we really were considered, we didn't talk about that at all last week.
right.
Those few facilities. It didn't enter my mind, but I think it does need to be dealt with, so we're clear on it.
We have the same thing at the Fine Arts and the community campus as well.
I think one of
Renting
the,
those rooms, yeah, but I mean, yeah.
I think one of the differences on those facilities, they're a leased facility. I agree when this was thought of and drafted, it was designed probably more for the protection of the employees versus public events at those facilities. I guess as a proposal, Mayor, would be to approve the policy that is presented tonight, and then next week have maybe a report, a rebuttal on those facilities, how we want to handle that.
I don't have a problem with that, because there is some open questions on that, so,
But I guess I'd be in favor of keeping the momentum going what is black and white, so to speak, at this juncture tonight.
Right, what's the best way to handle that so we can get something signed and in place with the things we know how they're gonna be handled, and still allow us so that we don't push back all of these things another week while we get these questions? Is there a way we can approve, something that just says for non-leased buildings, get that part in place now, and then allow us to address the lease spaces later?
Well,
I
I
think
think
we
the
just
mayor
move-
made the point that it's a operating document, so we can alter it next week.
True.
Well, we could, or we could alter it right now with a simple amendment of just making exceptions to that. And then if you felt that those facilities should be a part of this, then we could put them back in.
Can I add one quick thing is, we may be able to talk to our insurance, see what kind of liabilities out there with the lease type properties, and see if they have a recommendation on a separate type of policy for those types of buildings.
Because there would be some liability, and if somebody may have caught it at those facilities and then want to sue us for that. Because we didn't provide protection for them. That could be very easy. So,
Well, those are big issues, and I guess we don't have the city attorney here right now, but ordinarily when you have a lease, the lessee, the person that's leasing the premises, gets the exclusive use and possession of those premises. So, I mean, if the hockey association has leased that, then they should be able to operate the facility pursuant to the terms of the lease. And that after the fact, imposing requirements on them might be a problem. Obviously, we can control this building, our employees, and that's what we're trying to do. We're trying to protect them. We're trying to protect the public that deal with our employees. And then finally, I think very significantly, we're trying to show the community we're very serious about this COVID thing and going forward. And we're taking some measures, but we are kind of going beyond it a little bit when we say anybody who rents the banquet room at the event center has to have a mask on, or anybody that goes to a hockey game has to have a mask on, and anybody that goes out to Broadland Creek Pro Shop this winter to hit a few golf balls on that simulator has to have a mask on. I mean, like I said, we didn't talk about that last week, and I certainly didn't even think about that. So I would prefer just right now excluding those particular facilities from this policy. We can always add them later if we thought we had to. And certainly a citywide mask mandate is still in the tool belt for consideration later, and I know we'll probably talk about that a little bit during the COVID update, but I will just point this out. Just today I got an email from the chamber. They're doing a survey on, whether their members, would like to see a mask mandate or not. So, I mean, there is discussion about it, and
that was something.
certainly probably is going to have to be considered if we
That was
can't get
something
it.
we requested for them to do the survey.
But I'm not proposing a citywide mask mandate at this point. But at some point, we may have to do that, and maybe sooner than later. But anyway, that's what I would suggest. I would move to exclude, I would move to amend the policy to exclude where it's at,
Like Bergman Arena, Huron Event Center.
The only thing with excluding the facilities is like, for instance, within the campus center, we have city offices that we would like Parks and Rec, to be following the same procedures as, so rather than exclude the facility, maybe your motion could be to exclude leased spaces.
Right.
So anything that's under our direct control would be, and anything that's a lease space would be something we can look at next week.
So just to be specific, I'll make the motion to amend this policy under the visitors/mask paragraph right in the middle, where it says all visitors to city buildings, with the exception of the leased portion of those buildings, will be required to wear a facial cover. Do you think that'll cover it? Okay, so that's my motion. That is-
Motion on the floor, do we have a second on that motion?
I'd second that.
Okay, now do we have any more discussion on this motion?
We are still planning to potentially look into what we need to do in lease space for
We'll
future.
look into that, we'll check with our insurance people, check in with our attorney to find out if there's any things we need to look at there, and we'll report, hopefully get a report back next week. So
And you probably want to involve the hockey association for that particular facility, and maybe get Brenda Yeager and maybe Top Floor Events to talk about the event center, if we're going to consider changing it all for those. And anybody else who's renting space over at the campus center.
I would be in support of the amendment because of those. It's turning it more into, hey, you're changing this lease agreement. You're putting more restrictions, as you explained, Commissioner Cloyd, so I'd be in favor of that amendment.
So you're going to vote on the amendment first and then on the policy.
Okay. We good discussion-wise on that? Okay, roll call vote, please.
Smith?
Aye.
Clute?
Aye.
Craig?
Aye.
Robish?
Aye.
Mayor Harrington?
Aye. Now we're going to discuss the policy, we're going to vote on the policy.
We have a motion and a second on that already.
Okay,
Motion by Clute, second by Smith.
okay, any discussion more on that? Seeing none, we'll have a roll call vote on that, please.
Smith?
Aye.
Clute?
Aye.
Craig?
Aye.
Robish?
Aye.
Mayor Harrington?
Aye. Okay. So with that, we'll move on to 8.6, weekly update with the Beaver County COVID-19 Task Force. And Commissioner Smith is ready to go.
Excuse me. Thank you, Mayor. Commissioners have in front of them our weekly change, COVID-19 weekly change. I'll give you a second to get that graph in front of you. As the week progressed from November 2nd to November 9th, our total cases went from 1,423 to 1,682. That's total cases. A net change of 259. Total recovered went from 1,045 to 1,153 for a net change of 108 more. Total deaths unfortunately went from 15 to 19 throughout the week. Net change of 4. Total active cases this week from last went from 363 to up to 510 for a net change of 147. Large impact on that, as you can see, was towards the tail end of the week, and pretty much everything Tuesday, Wednesday, slight drop on Thursday, if 34 is considered a slight drop, but and then towards Monday to today of 15. The spike, we had 3 days within that were over 50 positive cases. Recoveries are in the gray bar beside the active cases, or excuse me, the new cases. And as you can see, it continues to be an evasive situation for us. COVID task force, as I mentioned before, generally regularly meets on Tuesdays. So the information that we receive on Tuesday that the task force discusses is a little bit dated, but the general principle of those meetings recently has been the outcry, continued request from the health community along with citizens within the community of possibly mandating mask wearing. Science has shown that that helps reduce the spread. Speaking on my behalf as a commissioner, we've obviously talked about that. We may continue to talk about that a little bit more tonight. I know there's some people out there, there's a growing population that we need to do something about this at our level, and that's up for discussion, I guess. I did check in with Doug Ramsel. Doug is the ops chief to get a little more update from today. Again, there's on the operations side a growing voice out there of mask mandating, again, to try to slow the spread. Healthcare workers are continuing to run short. Not only are they being affected physically being affected from COVID-19, but also just putting in a lot of hours trying to protect and not only take care of just the COVID-19 patients, but also other people that need medical attention. Today they sampled 57 samples done today. We anticipate the return rate on that of it just keeps bumping up the sample in relation to the number of positives. That ratio continues to climb, so they would anticipate a large number of those 57 to come back as positive. So we'd be anticipating again another rise tomorrow or Wednesday when that gets reported. A little bit of a bright spot, I guess, if there is a bright spot in all this. The hospital has reported that they have received some reagent supply, and the importance of that is they can return back to a 24-hour turnaround on the testing. Again, that's not unlimited, but they do have reagent again. There was a breach in there where they ran short on that reagent material, and that's why part of the reason why you saw that decline in numbers being reported, because it took a little bit longer to get the results back. That was kind of the roundabout from COVID task force, COVID-19 task force. But I wanted to continue with that conversation and bring it back into the fold of the commission of what we have done, and just to remind the citizens of what the commission has done throughout this very difficult time. If you recall, on that Sunday, we did put an ordinance into place, and that was a difficult decision. I know we all had a very difficult decision to make that day, and it was probably more difficult to lift that ordinance than put it into place. The majority of people were under the same momentum of, we got to do what we got to do, and that was very painful for a lot of businesses. But it did stop the spread, and that's been shown in our research and follow-up. I'm not suggesting that we go back to reissuing that ordinance by any means, but when we did that, we also passed a resolution, and I just want to repeat some of the things that were in that resolution. And that in the resolution format, it was practice proper hygiene, practice self-isolation, practice social distancing, practice no groups of 10 or more people allowed socially or at a business, Stay at home, contact your medical provider if you believe you have symptoms. Please limit trips to purchase essential items. Please limit time spent purchasing essential items. And stagger work schedules. That was part of the resolution that went in along with that ordinance. Fast forward to May 9th, 2020, where we met again and said, okay, we're going to lift the ordinance. The ordinance is the law, and we're going to lift that with a substitute resolution. The resolution that still is out there and still stands in the city's eyes implements a lot of those same restrictions, however, they're in a resolution format. One thing that I will note is when we provided this resolution out to the public, numbers were going down. Maybe we were falsely misled a little bit on getting too relaxed on the situation. And keep in mind, at that time, I believe our count got up to 22 active cases. 22. On this chart, there were 2 days out of 5 that we were under that number of active case presented. All the other ones were at least double that. So somewhere along the line, we've gotten to the point of trying to deal with it, I guess, on our own. This is on my mind more than it should be, as it is with everybody else. I've had friends affected by it. I've had neighbors. I've had family affected from this. I've had family pass because of COVID. And if we work together and not make it a political statement of enforcement, hopefully we can start slowing the curve again and bringing it down for the goodness of the public health, for the goodness of our public health providers, for the goodness of our schools. Something has to be done, and I think it has to be done by the citizens of the public, or the citizens of Huron and Beale County. And they don't have to do anything. It's a free country, I understand that. But they need to understand the severity of the situation. And if wearing a mask can help, I don't think we have to regulate that. I think if we were to put a mandated mask enforcement in place for everybody within the city, or even go one step further and put a shelter in place, my opinion is that by doing that, if we do a mask ordinance requirement or a shelter in place requirement, I believe that we'll create more division in our community than inclusion of the community. It's just too controversial. For whatever reason, it's too controversial. I listened to the majority of Aberdeen's City Council meeting from November 2nd, and from what I was listening to, they're kind of on that same page. It's like, we can mandate this all we want. How are we going to enforce it? We don't have the resources unless we bring in martial law of some nature to enforce it. In theory, basically shut down the city and the county to do that. If it's for 30 days, 45 days, we don't know. And if we put something mandated in place, when are we going to end it? We have no idea how long this virus is going to be. It's like trying to capture the wind. And so I've been asked several times, when are we going to put a mandate on mask wearing? When are we going to shut the businesses down, shut down social events, et cetera. And I guess I'm just sharing my personal thoughts on it. And I apologize, Mayor, for using this as a public or a personal platform, but it's questions that I've been asked as a commissioner, and I'm just expressing my view.
And I appreciate that. I think we all appreciate your views, Commissioner Smith. I also listened to the November 2nd Aberdeen City Commission because I got wind that they had been in the same struggle we're in, trying to figure out, do we have mandatory masks or not? So I spent a good hour this afternoon listening to their commission meeting from November 2nd, and they came out with a resolution, but right in the resolution it says there is no enforcement. They had similar discussions that we have. They're torn between what's good for the it handcuffs the economy. They're afraid of that. Some of their suggestions was to let businesses develop their own practices and for our public to adjust to daily activities. And what they were talking about there was the fact that so many of our businesses now are providing services. You can go to the grocery store, sit in your car and tell them what you want, they'll bring them out to you. You can go to a restaurant, tell them what you want, go to the curb service. There's so many of our activities that, whether it be our library, our city library, you can call and tell them what book you want, they'll bring it curbside to you. So there's so many activities that people can do. They're going to have to adjust how they live for the time being of this COVID activity. So I got a lot out of their meeting. It was interesting to hear other people discuss it. It's also interesting for them to, their vote was close. If they, in my opinion, if they voted on mandatory, it would not have been close at all. Nobody would have voted for it. So when they voted for this, I think the vote was about 8-5 or something like that. It was close, but they came out with a resolution. The one commissioner was really concerned that just doing this resolution wasn't going to solve anything, and he thought they wasted their time. Some of the others, including myself, felt it was good to have the conversation, just like we just had with Brian. Listen to what he had to say was good for all of us to hear also. So that's really all I got to say on that too. We will have a task force meeting tomorrow at 1:30, and this will be the main topic. Our mandatory masks and those on that. We're at a loss of words a lot of times, just trying to refigure what we can do and can't do and what's expected. I will say this: Aberdeen did have surveys. That's where the idea of the survey came. I called. We talked to Lori. She said she'd put one out. They did a survey. They also went on Facebook and did a survey. None of them wanted mandatory masking. It was like 100 to 50. Most of them were that far apart. So that's just a measuring tool. It doesn't mean that's how they should have done it and didn't do it. But that was a measuring tool. They wanted to get some feedback. They got feedback. So we're going to try to get some feedback through the survey. They're going to survey the chamber members what they're going to do and see what their thoughts are on the question. So that's really all I got to add tonight. Any other questions? Any other discussion? Yeah, Mark.
There's all kinds of questions, of course, and there's all kinds of comments, but I guess my first question was going to be, before you said that about the chamber, have they pushed the, I mean, we're here talking about mandatory masks, non-mandatory masks for several Monday nights now. We talked about it. And just, I'll go on the record, and I will never vote for a mandate on hardly anything. On hardly anything. But Brian brings back to our discussion in March, and yeah, we were all desperate because we knew nothing. We know more now, but we still don't know much about coronavirus. We don't know much about it. And I know I hear the comparison of the common cold, the flu, and whatever, and that's okay. sometimes there's feelings not much more than the common cold or the flu. But there's more knowledge about that. There's more ways to fight that than there is the corona. Because there is no way to fight the corona right now. So if we were, Brian brought up those numbers. One number he didn't bring up though, Brian, was 2 deaths in March and April. Today, this week, we've had 4. We have had 19 in Beale County in this whole process. That's a huge number for this small of a county. That's a huge number. And where I could die from COVID tomorrow, or I could die from a heart attack tomorrow. It doesn't matter to me what I die from, but I have to be responsible, and I have to take care. I have to take it upon myself to be responsible, to do what I can do to help eliminate that, or whatever. So it's like, again, let's say I'll never vote for a mask mandate. I'll never vote for that. But nowadays, we can't highly encourage that. Very strongly encourage that. Like this policy right here that we have, I think that's really nothing. I don't think that has much teeth, to be honest with you. We don't even make our employees wear masks. We don't make them. We're going to in this building and in the library and whatever, but we don't even ask our employees to wear masks.
Well, I take offense to that. I think we certainly do.
I'm talking about, okay, I'll just use the solid waste,
They will be wearing a mask. That's what this says here, right here, city mask.
then I missed it, okay?
Yeah, city staff providing face-to-face service to the public will be required to wear a mask.
Okay.
It's right here.
Okay.
And also, if that's not enough, not being followed, we can update this living document.
And again, I don't want to mandate our people any more than I want to mandate the rest of the people of here. I don't want to do that, but man, I want to really highly encourage. You know what, if you can wear a mask, get a mask on.
That's why you'll see in here too, that all staff wearing a mask when in a city vehicle with another employee. I don't need to have city employees driving down the street in a pickup without mask on. If we're gonna say this to the public, they're gonna have to have that on within that pickup. You know, so our employees will be wearing masks, Mark. Whenever they're face to face with the public, they're gonna be wearing a mask.
That's great to know. And again, I will never mandate that. I'm just saying, please do it. That's all I'm going to say is please do it. That Wednesday night meeting that the task force had here was a very good meeting. It was very, very good. And some good points that came out of that is we had 2 healthcare workers over there. Sure, one had COVID, and he said in his opening statements that he was a survivor. Okay, I think is how he put it. And the other guy runs the hospital. Their people, I'm telling you, they don't get in the building without, you think this mask is prohibitive? They wear this mask, they wear another mask, and they wear a shield, and they wear a gown.
And they should.
And they do.
Because they're going to a place where they don't want to spread disease.
Exactly, exactly. So, and the kids in school, they wear masks, they don't come home, they don't cry to mom and dad because the teacher made me wear a mask. They don't do that because they want to go to school. So, just to make 2 cents worth, I guess, I look at that 19 death and that's what's the big thing to me.
May I have my 2 cents worth?
Yes, you may.
Okay.
Always.
Well, second week in a row, we had this discussion. If we're not going to vote on a mask mandate, then I just would not hear about it anymore because, I mean, you've already declared that you'll never vote for it, but I want you on record. I'd like to have a vote. I think what we need to do is, I think that's where we're at. I think we should schedule it for next Monday. I think we should give the public notice that we're going to vote on it, and then we can be on record. Because there's really not a whole lot more we can do. We've been cheerleading a while for it. I do agree with some of the things you said, Mark. I think we do know a lot more about it. I think the public should know that masks are needed. But apparently, because of the political thing, whatever it is, we've got a significant number of people that refuse to wear masks. And we've got charts that are going crazy like this. And are we gonna do something or aren't we? You know, I know a lot of people that cannot believe that we haven't done anything. And maybe it won't happen. I probably would vote for it. I think it is a terribly controversial thing, Brian. I totally agree with that. And how are we going to enforce it? Pretty easily, if we have the will. I mean, if somebody's in a public setting and are not physically distanced in a building, and they violate it, well, then they get fined, they get cited. I mean, it's no different than the state mandating the wearing of seatbelts. It's a public safety thing. And it's a temporary one at that. Public seatbelts, that's a permanent law. You gotta wear a seatbelt. You wear a seatbelt when you drive?
Not all the time.
Really?
Nope, I don't.
Unbelievable. Anyway, we're just talking about while this pandemic is going on. There will be an end to it. We've got great news on the vaccine today. It's on the horizon, but there's some tough months ahead, tough months. These are the toughest months we're gonna have right now. And proof's in the pudding with these numbers, unbelievable. This little town has 500 active cases. Well, that's community spread. That's out of control spread. Out of control spread. You know what the next step is? Just closing down everything. And the businesses, they don't, a matter of personal freedom. Well, yeah, don't we want to go shopping? Don't we want to be able to move around freely? We're not going to be able to do that if we don't get a handle on this. And for people to say that they don't want to wear a mask because of personal, that doesn't even make any sense to me. It's lunacy. So I think we need to be on record. That's what I think. And if it goes down in defeat, fine, then we can quit talking about it. We can quit talking about it. We don't even need these COVID task force updates anymore, because I don't know what else we can do. I mean, I guess, run the testing thing and that kind of thing, and that's good. It's all part of it. But we're like we said, we're heading into the tough months. We've got school going now. Things are, people are just kind of going on with their lives, and look what it's got us. And when you talk about you'll never mandate it, well, you did. You closed businesses, Mark, remember? You closed them. I mean, talk about a draconian measure. And we took it. And the public was behind us on that. And now, for some strange reason, they can't get behind a mask. I mean, we're not asking them to close their businesses or stay, but you go into a public setting, you should have a mask on if you can't socially distance. That's all we're asking people to do. And we can ask till we're blue in the face until we put some teeth in it. A great number of people aren't going to do it. So I think we should put it on the agenda next week. I think we should let the public know about it. We'll probably, I don't know if you want to move it to a bigger location, or we just have them appear via Zoom or whatever. Limit debate on it, and let's go on record, and then be done with this. I mean, if we're not gonna have a mask mandate now, when we have 500 people that we know of are actively infected right now, who knows what the real number is, in a town of 13,000, 14,000 people? I mean, it's incredible. I mean, I'm coming in contact with people right and left. They, oh, I've had it. I mean, this whole town's, we're at an unbelievable rate right now, aren't we, Gary? I mean.
Well, what we got 18,000 people in Beagle County. So the 500 and something we're talking about is Beagle County, 18,000.
Okay.
Right now, we've tested almost 9,000 people. Now, they may not all be Beagle County, because we've let some sneak in the door out there. But we've tested almost 9,000 people. Half our populations have been tested. So we're getting farther on that end. Interesting enough, today I was out looking at some, like I said, I did some studying on with Ebony and stuff, but I ran across Mask Up South Dakota. That's a thing that's being headed up by our medical hospitals and association. So I started reading that. In their go out and read this. You want to read this because they talked about what they want with Mask Up South Dakota. But one thing they say, if they don't want mandatory masking. This is right in Mask Up South Dakota, headed by our medical associations. It's right in their agenda. It says we do not want mandatory masking. I read that 2 or 3 times. I went, here's the hospital association, medical association of South Dakota, don't even want that, do it. That stunned me. So there's your mixed messages. That's what we're getting all the time. Nobody has all the answers. We're getting mixed messaging, and so it's tough to make tough decisions when you get messages that are mixed.
Well, I like I said, I think at some point we're going to have to take a stand on it. When are we going to do it, Mayor?
Well, I don't know that. It's up to these people.
But I mean, I want to give the public some notice of it. I don't want to do it in the dark of night and just slip it in. I mean, I want to be transparent about it. And I don't have any illusions about being successful on it. Because I think I'm probably the Lone Ranger. That'd be my guess. I'm not quite sure where Rich is at. Mark's already been adamant. Your comments are pretty clear to me, and Brian seemed to think that it wouldn't work either. So it probably would go down to defeat. But I think then at least the public would know we had publicly considered it.
Do you think
And
they
then
don't
we
know
can be
now?
done with it.
Every meeting for the last 3 weeks we've been doing it.
Well, but we haven't ever voted on it, have we?
We never got to the conclusion, no. Because we get like mixed messages. We're still trying to figure out what the message is people are trying to give us.
Well, I'm not quite sure I understand what
Well, what I'm talking about is Mask Up South Dakota, headed up by the Hospital Association, a medical association in South Dakota, says right in their thing, they don't want mandatory masking. That confuses me. Maybe it doesn't you, it does me. These are the people that, as Mark says, they go in every day, they mask up, they go to work with the people that are sick, but they're saying they don't think we need mandatory masking out here. That's confusing.
Well, I guess I'm not familiar with that. I just read today, though, the governor of Utah, not exactly a liberal bastion, just imposed a statewide mask mandate. So, I mean, it isn't like it's a crazy idea and hasn't ever been tried before. I mean, a lot of the country is under a mask mandate.
That would make it a lot easier if we did have a mandate, if it was mandated by the state. It'd make it a lot easier for everybody involved.
Well, I can't control the state, and
Because
I think we all know that's never going to happen.
That's all on everybody be on the same page then. Right now,
Yeah.
we're not on the same page.
Yeah.
Citywide.
Well, all we can do, though, is what we can do. We're the city commission here.
If I could
Go ahead.
add a few more things to that. One of the components that we have to strongly be considerate of is the schools. They, between the public and private schools within the city, they oversee probably well in excess of 3,000 to 4,000 students within our community. So that represents 30% of the population roughly. One of the things that I am concerned about, Doug, and I appreciate where you're coming from. I think the message that you're trying to come across is, let's either take a stance on, so the public knows where we're at with this as the city body, or quit talking about it, kind of a thing. Something that I've also thought about is, you know, the mask mandate has been kind of a hot potato. That seems to be the controversial thing within the communities that have been voting on this. What about all the other precautions that should be taken? Washing your hands, for example. I mean, how far do we want to go with that? Okay, so now it's, if it were passed as a mask mandate, then is it going to be a wash your hands mandate coming to prevent it? That's something that I've kind of been thinking about, you know. And your point on regulating it or fining people for it, I don't know how we would do that. I really don't. If the police department, the dispatch had an outbreak of calls of people in various social rings that were gathered, or businesses calling in saying, hey, we've got 6 people here that refuse to wear masks. Well, if that all explodes at one time, how are they going to cover that and yet maintain civil decency within the community? So I do agree that let's move in that, but let's either have a vote on it, or I can provide you updates on it from the task force, but there is a strong indication from the task force that they would like to see city and county government make some form of a decision on this, of either trying to continue to encourage voluntary mask wearing along with other social protocols and COVID guidelines. But an observation, like I just look at other communities. I have a friend and one of our coworkers that lives in Brookings, and on my way over here, I asked him, I said, how's this going in there? He said, you know, people followed it for about the first 2 weeks. They do have an out in their ordinance that if you have a medical condition, you're not required to wear one. Well, all of a sudden, there's a lot of people in that community that have medical conditions. And, you know, so they provided a loophole in that, I guess is what I'm suggesting. But his point was after about 2 weeks, it started kind of sliding back to where we are now. And so
if I can
that's
go
all
back
I'll
to
say.
the beginning of my comment was the chamber, I'm not putting anything on the chamber. I'm saying the chamber because they run the businesses of this town or whatever. They look for businesses, but I'm just thinking of, I don't go to very many stores now. I think a lot of people have their, the stores that they go to, and I do, not very many of them, but I don't see them on the doors. I don't see the grocery store that I go to, there's not one thing signed on the door saying, please wear a mask. That's what I was getting at. I didn't mean to wake a giant over here, but, and I appreciate your comments, Doug, I seriously do. But what I was getting at is, I don't see the plea out there. Yeah, we talked about it, and we all know, if you see somebody wearing a mask, it's like, oh, God, I should have known. That's not that big a deal. But anyway, I don't see that big plea out there. Where my business, we don't have public walk-in, very little. We have a sign on every door. We have several doors you can get in the building. We have a sign on every door. Please wear a mask. I don't see that on a lot of businesses. That's what I'm saying. That's where I was going with that. If we're here to plead, to ask for those, please, please, please. That's what I'm asking. Why don't you just ask to wear a mask? Why don't you just ask people when they're coming into your store, why put a sign on your door and say, please wear a mask? Now, you're not saying you must wear a mask or you can't come in. That's not what you're saying. But you're really asking them, put a mask on. That's what you're doing. I don't see that very many places, that's all I'm saying. I should have just said that and stopped.
One suggestion that was made was, rather than mandating it, something like this was to put out a challenge to the citizens of follow the protocol for 30 days and see what happens. If everybody, for the most part, if the majority of the people follow simple protocol for 30 days, see what happens to the cases, and prove it wrong or right, whichever line it falls on.
Haven't we been doing that all summer long? All those Smokey the Bear signs with the mask, you know? And, I mean, it's been a public campaign all summer long.
It has, yeah.
I mean, I don't think that, yeah, I mean, at a minimum, we just gotta keep doing that, I agree with that, but are we at a point where we need to,
Draw a line in the sand.
we need to take what measures we can? That's the way I'm looking at it, we're getting numb to the numbers, and when you compare them, like you were saying, you know, those early numbers, I mean, they're nothing compared to this, nothing.
Right. And the other thing with, that is having a bigger impact, or at least I believe is having a bigger impact because of COVID, is not necessarily, well, it is because of the people that are being infected, but it's the ancillary effects of it. You know, if you're contacted by the Department of Health and you have to self-quarantine because of close contact, that's affecting employers dramatically. There's one business in town that had to shut down for 2 weeks because of that.
More than one.
Yes, more than one.
Can I just ask the commission, do you want to take a vote on this? I mean, I don't want to go through a big exercise and, you know, just have it be a division thing. I mean, if it's not going to get a fair hearing, I mean, if it's not going to go anywhere, I guess even why do it? And then I'll be quiet about it and I won't ever bring it up again. Because, I mean, I think that's where I'm at on it. I get asked, well, what are you guys doing? And we haven't done it yet. So, but there may not be a reason to do it if all we do is stir up a lot of dissension and have it, you know, if it's 4-1, let me know right now and I'll shut up. Or if you keep an open mind about it. I mean, what will it take? Will it take, if we go to 750 active cases, is that enough? Is it 1,000? Is it 25 deaths or is it 30 deaths?
I think that's the elusive component of it, Doug.
Well, I mean,
I guess I would say I think the bigger elusive component to it, I think there's one word that's at issue, because I think all five of us probably have pretty similar thinking on this, except for the word mandate. And that's the one, you know, this is a statewide issue. This is not something that just Huron has been facing. As we said, Aberdeen, Brookings, what they went through, you know, my wife had spoken to the mayor down in Vermilion. They used a mass expected type of language, and that's had some success, but not the same. You know, the word mandate is really the piece that I think is what we're all hung up on, and probably what most of the folks reaching out to us are hung up on. And, you know, I would just say, you know, a couple quick things. A lot has changed in 3 weeks since we first talked about this that I think is worth mentioning. You just used the expression, we're numb to the numbers. We said the same thing 3 weeks ago. We were numb to the numbers and we had 200 cases. Now we have over 500 active cases. And that still has not shown any sign of of any kind of a plateau or dip. It just keeps going up and up and up. You know, we talked about those, certainly we all hear from and know that there will be a lot of opposition to a mandate or to anything regarding masks, but I think I just want to summarize. I made a few notes and I don't want to be too repetitive, but you know, there are folks out there, and I think we've all, or at least I know I have, and I know you have, Doug, for as many people that come up to us and say, you better not put a mandate in, we do have people saying, why the heck haven't you put a mandate in? What are you guys doing? So there are folks out there that feel like their freedoms are being taken away because they can't go out in the community safely because there's not any kind of a masking protocol. You know, the other ones we talked about, I think the hospital and our healthcare folks have been very clear on their request to us to help out. The school district you mentioned, you know, Superintendent Nebelsick was here last Wednesday, and he talked about the fact that most of the issues they're having because of their masking protocol in school, they feel that they've been very successful in curbing the spread within the school. They feel like most of the issue they're having is when their students and their staff are outside in the community and they're actually bringing the COVID in because we don't have a masking protocol outside of the school. And then I think our businesses, as much as, you know, as a business owner, I will say myself, I don't like the idea of telling my patrons, you have to do something to come in my store, because that's going to be a point of friction. However, I would also say, much like your comment, Mr. Mayor, that if the state would make a mandate, that would make it much easier on us as a city. I think you can say the same thing, that if we as the city were to put something in place, we would make it easier on our businesses. Because we can all sit up here and say, why aren't the businesses putting signs on their doors? But if we're not willing to take a stand here, then how can we expect the businesses to do that? Whereas they could definitely rally behind that support if we were to do something. So, you know, I think I don't want to have to close my business. I know most business owners don't. Obviously, if given the choice, as Dr. Bob put it, and as the mayor highlighted last week during this meeting, if the choice is either wear a mask or be closed, obviously I would much rather. I wish we didn't have to do either. But if that's what it comes down to, and with over, you know, 200 to 300 new cases in just the last couple of weeks, what we're seeing across the state, at some point we are faced with the fact that we may be looking at, if we don't figure something out with masking in some way to curb this, we are going to see those shutdowns. And so, you know, to answer your question, I think we should address this once and for all next week. Now, whether that means we definitely are voting on a mandate, or if there, you know, you said a resolution, you know, certainly that doesn't have the same teeth. But if we make an official statement, would that be beneficial? I don't know. That's something we could address, have the week to look at. Maybe an official support of something like Mask Up South Dakota. You know, maybe there's something we can get behind there. I do agree that this is now the third meeting in a row that we've talked about it. And 3 weeks ago when we talked about it, I was mostly hearing from folks saying, I don't want anything to do with that. Now, each week, I do continue to hear more and more, and it will be interesting to hear. I would strongly encourage anybody that received that email from the chamber to please respond to that, because that will be valuable data. Anyone out there, please let us know your feelings, because I do feel like next week we should take some sort of action. I'm not saying that I would support or that that should be a mandate, but I think there's enough folks, whether it's the hospital, the school, the businesses, the individuals that feel challenged by this situation, we do owe it to them to take some sort of action as a city. And I think we should have that on the agenda for next week. That would be my answer to your question. And ideally, it would probably be something, I was the one guy here that wasn't a part of what you guys did in March, but that was cooperative with the county, was it not? So how does that piece of it work? If we, you know, I assume they're also going to be meeting, and you folks through the task force will keep us abreast of that, but that is something we need to think about, whatever we decide to do from the city side. obviously we want to make sure that that works in conjunction with what the county is doing.
I'd almost say what we should do is put it off for 2 weeks, have a vote in 2 weeks, because that'll give them an opportunity to get in front of their commission, which will be not tomorrow, but next Tuesday. And then we could have our vote and give the public plenty of time to figure this out, that we're gonna have a meeting. And if we get enough feedback, we probably have to move it out of this little hole we live here, because it won't be big enough. So we need to do a little planning, but I'm all for it. Let's have a vote. Let's have a vote. And but I just soon bump it up 2 weeks, so that gives them the chance, a good question about the legal counties, let them get in front of their commission and talk about it, and not a short notice.
That's a good point about giving us a little time to prepare for it, because we don't have language on the man, and we say mass mandate, well, where's the language? What does that say? It's like, so maybe we can get some
Today's today the
templates
9th?
for that.
Today's the
2 weeks
9th.
would be the week of Thanksgiving, November 23rd.
That's a Tuesday, or a Monday night, yeah, so
Right before Thanksgiving.
we can still do that. I don't think people would be leaving on Monday to go to Thanksgiving.
And in the meantime, I mean, there's still a concern, what's going on out there is not gonna wait for us for 2 weeks. So just to echo what Commissioner Clute said, in the meantime, you know, I know there's a lot of different personal opinions, and we're certainly not gonna change anybody's mind. If someone has a belief in wearing a mask or not, whatever their feelings on that, just because we're up here and talking, we're not gonna change that. All we can say is, you know, please look at the numbers, look at the number of deaths, look at the number of cases. You know, one final little piece of data, I do still continue to hear people say, we only have more cases because we're testing so much more. And you know, you guys can speak to that, that is no longer the case. There was a time when that was true, that we were not testing very often, and then as we got more tests, the number of positives went up. But at this point, we're seeing a spike in positive active cases, and we're actually testing less now than we were, say, 2 or 3 weeks ago when we had fewer cases. So, you know, there's some of those things circulating out there that I think are counterproductive to the whole discussion of keeping our town healthy. That's ultimately what we want to keep our businesses open, we want to keep people out of the hospital, and we want to keep healthy. So in the meantime, while we get our act together, please, you know, folks out there, do everything you can to keep Huron open and healthy.
Well, then the argument can be made on the number of tests and you know, the ratio of that. But the fact of the matter is, this is the data that we have to work with. You know, and I'm not saying it's 100%, because there could be some flaws in it, but the bottom line is the bottom line of 19 deaths. That's pretty final. And 500 and some active cases, it may not be exact, but it goes back to what I said before. Anything north of 20 before, the sky's falling.
Yeah. I mean, isn't the positivity rate like well over 40%? I mean, unbelievable.
Yeah, it's closer to 50 to 60%.
Unbelievable.
And climbing.
We're right at the top of the food chain in the whole country right now.
It's
not
becoming
good.
more restrictive on how they test too. You just can't, you have to have certain symptoms to even be tested. But, I don't want to belabor it, but the bigger effect on this from a business standpoint is the number of people that have to take time off because of quarantining, or you know, maybe their daycare shuts down because of it, their kids home, whatever the case might be, or their spouse. It has an enormous impact on our workforce. So I'd support that. I mean, you know, let's get our research done.
Well, let's target it for 2 weeks then.
Well, and I think waiting for that survey to get some public opinion.
Yeah, we'll get that, we'll have that. And like Rich says, I mean, we could do something next week, but I think 2 weeks would give us more time to develop something that people could read, and we could all think about it more, and to plan to have some public input and,
And that format for the public input. This room gonna be big enough.
When it's
so we
you
gotta
wanna
face
do it on
that
Zoom?
issue. I don't know if I wanna, one of the things I don't wanna do is create a super spreader event when we're talking about trying to prevent the virus,
So would
so
you-
we have to figure that out.
Could you do it on Zoom?
Well, that's a good question, for your tech guy. I mean, we've had Zoom meetings where the public have, remember that Saturday meeting? I think we had like 100 people listen in, and they were able to make comments, so that, why couldn't we just follow that format again? Because I don't want to have 250 people in a small room. I mean, I don't think that's counterproductive to what we're trying to solve
And
here.
I think the Zoom technology and whatnot has come a long
Yeah.
way from where we started. You could also look at the template, the school district had a couple of meetings that they held in the high school auditorium for the same reason, that they knew they were gonna need to be able to social distance. So I think there are alternatives if we feel like there's gonna be a challenge.
Might also keep down the public rancor and, what I mean, to keep the temperature down a little bit, but still allow for public input.
So I'm thinking now with my finance hat, do you want us to put something in the paper for a public hearing? Or just have it posted as a regular meeting?
Well,
How about a nice light blend of each?
We'll come up with something.
Well, I think we need to come up with some language first. Maybe we can have that by the next meeting, but the press is here. You could probably report that we're going to be dealing with it in a more definitive way in 2 weeks. But the outlines of that will become more apparent as the next few days go by, right?
Yep.
How's that sound, man?
That sounds good. That sounds good.
The other timing issue that you have to consider is if the vote is on an ordinance, that would have 2 readings. Versus if there were a resolution that may affect meeting. Ordinance would be a penalty law, if you would.
Well, and I don't know if we want an ordinance. I mean, I think everybody would agree that we would want it to be temporary. I mean, if the pandemic ended, we'd want it to end. We'd want it to end. It's not a permanent type thing. Doesn't our resolution have potential penalties? That was what the whole issue was, wasn't it?
Yeah.
So, I mean, we could still have a mandate, an enforceable mandate, if that's the right word, with enforcement mechanisms without going through the ordinance process. That's the big issue.
That
Are
would
we
be,
making something enforceable or not?
that would also give our attorney time to dissect that, because it does get a little confusing. I'll
It
be
is.
the first to admit it.
Yeah, I don't have all the answers, and I've never really even seen the mandate language that Brookings has. Well, maybe I did see that, and I didn't really like it, to be honest with you, but I'm sure there's others, and, like I mentioned, Utah just went to one. Maybe take a look at what kind of language they have there, and
And I think Commissioner Smith made a good point too, in regards to, we want to take a all-inclusive approach to this, and for instance, you mentioned a couple of weeks ago that the idea that there were people out there that were awaiting results of tests or even had tested positive and were still going out into the community, that certainly can be part of what we talk about too, because that's probably a piece that we'd have more support on. I probably hear more people frustrated with that. So-and-so was in my business earlier and saying he's off work because he got a test and he didn't want to go home. Well, that could certainly be a part of the whole piece we take up. But yeah, if we could maybe have a preliminary idea by next week and then be ready to vote on it in 2 weeks. Then.
Sounds like a plan.
Just
Anything
a-
else?
We do have one thing on, I'm sorry. We do have to vote on our surplus item.
It seems 8.7 seems
One more item on
Still
the
on
agenda.
there.
not very
8.7.
important.
8.7, okay. We'll
I know it's not a,
We'll go to 8.7. This is a fuel tank surplus recommendation. Pauline, do you have that recommendation?
I do. So our appraisal committee was Rob Rieger, Del Forden, and our assistant city engineer Dennis Bennett. They're recommending that we could sell the tank for $475. So asking for approval.
Move to approve.
Second.
Any more discussion? That's good. Roll call vote, please.
Smith.
Aye.
Coe.
Aye.
Brown.
Aye.
Robish.
Aye.
Mary Harrington.
Aye. Nothing further? We're done.
Mr. Mayor, this one didn't get signed.